Well, hello and welcome to all of you tuning in today. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Today, I'm very excited to be talking about our up and coming GOLD Lactation Online Conference 2023. That's right, folks. It is here. It's arrived. I'm so excited. I have to say that working on this conference for a year, there's a bit of excitement and buzz at Gold, because we get to announce all the speakers, we get to talk with them. As you can see, my very good friend and colleague Hope Lima is here again with us, back by popular demand, of course. I'm going to be talking about something really exciting in just a moment, but let me tell you how you can connect with us here at Gold Lactation. So you can go straight to the website right now, goldlactation.com. We're open and ready for you to register for this event. We'll be opening on April 3rd. Okay, so that's the calendar. Go to your calendar, give it a nice big circle. That will be a live event. That will be one of our opening keynotes. And if you've never visited us before here at Gold Lactation, this is your opportunity to come in on April 3rd and listen to a live event completely free. That's right. All of our keynotes here at Gold Lactation are free. You can come and sit in, listen to some education, be part of the community. Let me tell you that this community here at Gold Lactation is just phenomenal. Every year, people come back again and again in order to be part of this, to learn together, to get the latest research, and we're excited to be presenting that to you here. Well, without any further ado, please welcome Hope Lima. Hope, it is so good to have you back here at Gold.
Hello, thank you so much for having me back again.
So tell me, give us a little rundown. How have things been going? What have you been doing and all the things?
As usual, for those that know me, I've had a lot of hats on. I am still working at Winthrop University, still doing research. We've launched a couple of new trials, which is exciting. Hopefully in future years, when we have some data, I can submit to Gold to share that with everyone. I still have my private practice, so still seeing moms and babies. And I did add a pediatric allergy specialty to my toolbox over the past year or so. So
Oh,
kind of been
wow.
in everything, but I like to stay busy.
Yeah, I mean, I think you're the epitome of keeping things balanced, because I have to mention too, your social media channel. I follow it. It's fabulous. So thank you so much for that. It keeps me inspired. It seems to pop up, so I know I must be following you a lot. So that's really awesome. I see you on Instagram. Are you on other channels as well, Hope?
Yeah, I'm also on Facebook. I'm not
Ah.
super savvy on the TikTok side. I'll leave that to people who have a lot more talent than I do, and time probably.
Well, that's awesome. That's awesome. So you're still doing the research, which is just incredible. I think that's an area that, we want to continue to see you thrive in, because you're so good at the knowledge translation, which I find is one of the struggles that we have, because for those of us who are not in research, we need folks like you, Hope, to come back to us and, of course, really just relay all the information, sometimes in layman terms, of course, for those of us who love to hear the research but can't always translate it. And it takes time. I think that's the other thing. I think that's what puts people off. But yet it's such an important part of our work, because let's face it, let's just talk about it right now. There isn't a lot of research in our field, right? And this is where we struggle with all different, aspects of the research. Now, let's talk a little bit about your topic. I'm sort of teasing into it a little bit. When folks learn about what you're speaking to, I want you to give them just a little bit of information so that they can, because I know that this, to me, that's why you're here, because we just thought that this was such a good topic. So this is the title of Hope's presentation: Provider Perceptions of IBCLCs in Primary Care Settings, a Pilot Study. So Hope, give me the lowdown on, first of all, why this came about. I think that's always so important, and what we can anticipate from this presentation.
Yeah, so I definitely agree with everything you just said. Research is super lacking. And on top of that, we have the need for increasing breastfeeding rates. We're still not meeting our Healthy People 2030 goals in the US, and globally we have, goals that we want to be meeting. And so this study actually arose because initiation rates with the Baby Friendly Hospital Initiative have gone up, especially in my area of the world. But those duration rates are like, it's really difficult to get them to inch up. How do we keep people breastfeeding or chest feeding? And so I did this because in my area, there is not a lot of integration of the lactation consultants in the primary care setting. It's they refer to us, but we're not inside of those settings. So I really wanted to see what primary care providers feel about lactation consultants, what they think our role is, how they're referring, are they referring? And I feel like we caught a lot of really interesting data. Some of it I expected and some of it was a surprise.
Mm,
We also looked a little bit at where are primary care providers getting their breastfeeding education and how much are they getting, which
right.
was of interest to me as well, knowing that sometimes there's a discrepancy between recommendations I'm making to people that I'm working with and what they're hearing maybe from their primary care provider, their pediatrician. So I think we got some really interesting pilot data. It's definitely a pilot study, but
Sure.
it's a really interesting start place, I think, for expanding. I would love to expand into more of like focus group or interview style to get more information on this topic.
Ooh, so some juicy things happening in this area. Okay, can we talk about a couple of things, because I think that I think I can say, when I'm being honest, that maybe there's some frustrations between, primary care and lactation consultants, in terms of just education recommendations. It's hard sometimes to collaborate because it seems to be that there's just such a big gap, right,
Mm.
between us. And I don't know necessarily, maybe I don't know if some of your study told you this, but I think it's a frustration that is aired out in our profession. We want to do better. We love collaborating. In fact, collaboration has become something that, we have tasked ourselves with to be good at, right? To say,
Mm.
okay, this is not within my scope. I can't wait for, you to be part of this network. We're really working hard. So you would agree with me, right? That there's this sort of gap that we're
Yeah.
noticing.
I
Yeah.
definitely agree with that. To this day, tell my students and the students that do research with me, I have had my practice now for almost 5 years. And in that time, I've had one pediatrician call me after I sent them a follow-up report of I saw a mutual client. Here's what I was seeing and recommending. Many, many times that I need to call them and try to get in touch with them and needing to repeatedly try to touch base to get some communication going. But I definitely think I've experienced that, and the people that I interact with in this field also experience that to some degree.
Yeah, absolutely. And I find it's really interesting because I'm very similar to you, been around for a long time. And every now and again I get an opportunity to sit with some of the local docs in my area, and they know me. They've heard my name. They often are, sending clients to me, but it's very passive. It's not, formal or anything like that. They've said to a client, oh, you should go and see, Fiona, right? But it's this very passive sort of relationship. So it's interesting that, when I get into conversations, it's like, oh yeah, we're all doing great work. Thank you so much. That's fabulous. That type of thing. But yet there still seems to be the gap. Is it just because people don't know how? There hasn't ever been this sort of channel, has never really been open. So people are just like, okay, we're just kind of winging it. Is that what's happening?
Well, we do have some data from a couple of different perspectives on
Mm,
why they are or aren't opening those
right.
channels. But
Ooh,
I do think that it's a little bit lack of knowledge of what does an IBCLC do? What's the actual scope of practice?
right.
I've definitely heard experiences and experienced myself statements like, well, your latch looks fine, so I don't think you need a lactation consultant, in
Yes.
that little sphere. But that's really a lack of understanding of what is our scope of practice, what do we have education to do, even what are the specialties of the different lactation consultants in your area, because
Right.
I definitely do a lot more with nutrition as I'm also a dietitian, but I have a good colleague in Charlotte, 30 minutes away, and she's fantastic with oral motor dysfunction. So, knowing that there's different areas of expertise is also, I think, one of those barriers, that it's not just, well, everything looks okay, so you probably don't need a lactation consultant.
Right. Oh, I love that. Oh, this is gonna. I had goosebumps just as you were talking about that. It's so interesting. I'm sure for those of you who are listening in now too, well, you're starting to recognize some of this pattern of behavior maybe in your community. In fact, if you do have some ideas now as you're listening to our conversation, pop them in the comments below and send them off to us, because I think this conversation is going to be so good, Hope. I'm excited that you're going to be here live at our Gold Lactation event again. It just means that I know you've got some polls in your presentation, but really there's an opportunity here when you come and sit with myself and Hope. This conversation is going to blow up. I think there's going to be so much conversation about this. And I'm excited that Hope is going to lay out some of this pilot study for us, because this is the tipping point. This is part of the tipping point of what is to come, right? So we need a starting point. We need to be engaging. We need to come with all the ideas. So you guys come with the ideas. Hope's going to be here with the study. I'm going to help facilitate things. I'm ready. Okay, Hope, I'm ready. Let's dive in, right?
Yeah, me too. I can't wait.
Yeah, that's fantastic. Well, thank you so much again for being here today. But, this particular topic is really going to be fabulous for so many people who are finding it difficult or just wanting to know, what is the next move? What can I do to help facilitate my work, my effort in the community? How do I connect with people? What's the best way? What's the expectations? We want to be part of that setting as well. So this is a great opportunity. So again, thanks for doing the study. Keep up the good work. I can't wait to hear you teasing us today with even more research is very exciting as well. So I can't wait to hear from you again about what's coming down the pipeline. And I'll look forward to chatting with you live at our Gold Lactation event.
Thank you so much.
And for those of you, again, listening in, don't forget to head over to the website. You can check out the schedule is all ready now, so you can check out when Hope is going to be with us here live. Now, for some chance, for those of you who might be busy or can't connect on that day, do not worry. We will be recording, of course, all of our events, and then you'll still have opportunity. That's right. You'll still have opportunity to actually ask Hope some questions. She's going to be here as part of our forums, which is exclusively and dedicated to the participants only of the event. So just know that you're not going to miss anything, folks. You'll be able to come and join us live. Make sure you head over to the website right now to goldlactation.com, and I will look forward to seeing you online. Bye-bye for now, everyone.